गुड इवनिंग एवरीवन। मैं सिम्मी सिंह आज के इस सेशन में आप सबका स्वागत करती हूँ। IFPH यानी इंटरनेशनल फोरम फॉर प्रमोटिंग होम्योपैथी एक ग्लोबल ऑर्गेनाइजेशन है जो कोविड काल से लगातार डेली वेबिनार कंडक्ट कर रहा है। इस फोरम का मेन ऑब्जेक्टिव है होम्योपैथी के ऑथेंटिक नॉलेज को सब तक पहुंचाना और कम्युनिटी में यूनिटी बढ़ाना। चलिए सेशन शुरू करने से पहले 1 मिनट का मौन रखते हैं। धन्यवाद। आज हमारे साथ हैं डॉक्टर रुचि साहू, BHMS और MD इन साइकेट्री, एक एकम्पलिश्ड क्लिनिशियन, एजुकेटर और रिसर्चर। डॉक्टर रुचि ने अपनी हायर एजुकेशन ML धाबले मेमोरियल होम्योपैथिक इंस्टीट्यूट और महाराष्ट्र यूनिवर्सिटी ऑफ हेल्थ साइंसेज से प्राप्त की है। करंटली वे श्री स्वामीनारायण होम्योपैथिक कॉलेज अहमदाबाद गुजरात में एसोसिएट प्रोफेसर के रूप में कार्य कर रही हैं। इससे पहले वे अंतर भारतीय होम्योपैथिक मेडिकल कॉलेज नागपुर में असिस्टेंट प्रोफेसर के रूप में भी काम कर चुके हैं। उन्हें क्लिनिकल प्रैक्टिस, टीचिंग और रिसर्च तीनों में एक्सटेंसिव एक्सपीरियंस है। उन्होंने एक फिजिशियन और मेडिकल ऑफिसर के रूप में भी काम किया है, जिससे उनका पेशेंट केयर का पर्सपेक्टिव बहुत ग्राउंडेड और प्रैक्टिकल है। डॉक्टर रुचि एक एक्टिव रिसर्चर और मेंटर हैं। पोस्ट ग्रेजुएट स्टूडेंट्स के लिए रिसर्च गाइड के रूप में काम कर रही हैं और नेशनल और इंटरनेशनल कॉन्फ्रेंसेज में रिसर्च पेपर्स प्रेजेंट कर चुकी हैं। उनकी नोटेबल अचीवमेंट्स हैं STSH अवार्ड गाइड 2024, बेस्ट टीचर अवार्ड 2025 और आयुष कॉन्फ्रेंस दुबई में प्रेजेंटेशन शामिल है, जो उनके एकेडमिक और रिसर्च कंट्रीब्यूशंस को क्लियरली रिफ्लेक्ट करते हैं। आज का टॉपिक है पेरियंगल वार्ड्स एंड होम्योपैथी। पेरियंगल वार्ड्स जो नेल्स के आसपास डेवलप होते हैं, क्लिनिकली स्टबर्न और रिकरेंट नेचर के लिए जाने जाते हैं। कन्वेंशनल ट्रीटमेंट में ये ऑफन चैलेंजिंग होते हैं। होम्योपैथी में कॉन्स्टिट्यूशनल और मियाज्मेटिक अप्रोच से इन्हें कैसे इफेक्टिवली मैनेज किया जा सकता है, ये आज का कोर डिस्कशन है। आज डॉक्टर रुचि अपना क्लिनिकल पर्सपेक्टिव और एक्सपीरियंस इस टॉपिक पर शेयर करेंगे। अ वार्म वेलकम टू डॉक्टर रुचि साहू। ओवर टू यू मैम।
Yeah, thank you so much, Miss Simi, for giving me such a beautiful introduction of mine. I'll again just give a brief about myself. Myself, Dr. Ruchi Sahu, currently working as an associate professor in Swaminarayan University in the Department of Pathology. I am MD Psychiatry, PHMS, and today I'll be presenting my topic on the periangle warts. So, shall I begin with my presentation? Okay. So, good evening, everyone, all the respected chairpersons, distinguished delegates, faculty members, and my colleagues. Today, I'll be presenting a clinical and conceptual exploration of periangle warts and their management through homeopathy. So, talking about the periangle warts, these are often regarded as minor dermatological complaints. However, clinically, they can be persistent, painful, and cosmetically distressing, and notoriously painful for many of people, especially who are like very cosmetic conscious people. So, talking about the conventional mode of treatment, they frequently focus on the destruction of the visible lesions. While we, as a homeopath, we try to understand why a particular individual became susceptible to present condition, that is the periangle wart. Now, talking about the periangle wart, it become also a clinical challenge because it is a superficial condition which is treated superficially by the mainstream of treatment. But we as a homeopath, we try to seek and find out the cause for it, and understanding this, the cause behind it is nothing but a viral infection, and it is nothing but a viral proliferation in the first place. Through this discussion or presentation, I'll discuss the pathology, clinical evaluation, miasmatic understanding, repertorial analysis, and remedy selection, case management, and outcome assessment. So, when we encounter a wart, our immediate attention goes to the visible growth. How big is the growth? What type of growth it is? What type of wart it is? However, wart can be merely a surface expression of a deeper biological process. But as a physician. We frequently see the patients when they come. They sometimes or frequently they come after multiple cauterization of these wards or cryotherapy or electrodesiccations, and then they get to hear कि homeopathy में treatment है, then they come to us. But why? Because the host is susceptible, so the susceptibility remains unchanged in these cases. They just try to remove the upper superficial part, and they do not try to remove the cause, that is the viral proliferation, and the susceptibility remain as it is. Visible lesion can be compared to the tip, like we have removed it, so the person. So, as a homeopath, it raises a question that merely removing a tissue will not be like addressing the cause for the periangle wart. Now, what are exactly these periangle warts or verruca vulgaris? Okay, so this periangle warts refers to common warts caused by infection, that is human papilloma virus HPV infection, and this virus gain access into the body through the microabrasions in the skin, minor cuts near the nail beds. Talking about the periangle warts, minor cuts or skin abrasions near the nail beds leads to this proliferation or susceptibility to attract this HPV infection and lead to the proliferation. After the entry of this virus, it enter into the keratinocytes. It stimulates abnormal proliferation of the epidermal cells, resulting in lesion of hyperkerotic and elevated surface. Now, we need to understand that this observation is extremely important, that at what level the inflammation is, at what level the proliferation is, or how deep the inflammation is. Merely not cure the periangle wart. It will lead to multiple further reoccurrences. So, the exposure of this infection also, along with the susceptibility, explains the disease manifestation. Now, talking about the clinical variants, as we discussed, we are today discussing about the periangle warts, but there can be different clinical variants of human papilloma virus infection. Verruca vulgaris common warts typically found on the hands, fingers, raised surface or rough surfaces. Common warts occur on the soles, okay, soles of the feet grow inward due to the pressure, and these become highly painful. Then flat warts. Flat warts can be seen on the face, neck, dorsal hands, smooth, flat top papules like papular surfaces. And the last one is the specialized location, that is we are talking today, periangle warts. So these surrounds the nail margins, disrupts nail plate growth. Subungual warts are also under this category. It is beneath the nail bed, extremely painful on pressure. So this periangle warts, they distort the nail growth, causes the pain, and it also reoccur frequently. Resist conventional treatment. Now, talking about the evolutionary timeline of the periangle lesions, as we discussed, once into the abrasion or any open surface cut wound near the nail bed area, once the human papilloma virus get the entry, it completes its incubation period, and then present as a small, shiny, translucent lesion, often painless at this stage. Okay, it just appear like a blister, a fluid-filled, shiny blister. So, over the time, this viral proliferation increases, and this lesion, multiple lesions can coalesce and produce large cauliflower-like structure. That is the mature manifestation. Before that, there is proliferation. It loses its translucency. That is the blister-like appearance which was there in initial phase, that will vanish, lead to the texture transition and smooth to rough surface, leading to the complete maturation and develops into a rough gray, brown, or black. Now, patients commonly present with rough hyperkeratotic lesions, nail distortion, pain during pressure, cosmetic embarrassment, difficulty in writing and handling objects, and yes, of course, many times with a complaint of the cosmetic purpose, that this is something, because the warts, these are usually considered as ugly warts. So it is something ugly growth which I want to get rid of. So they many times come with these complaints also. In advanced cases who had been to multiple ointments and local applications, applied multiple local ointments. So in advanced cases, the secondary bacterial infections may also occur. These psychological impact should not be underestimated. Why? Because the patients get highly affected. It is a superficial aspect of the skin surface and very visible. It is very visible during the gestures and presenting oneself. Okay, so especially among adolescent and young adults, it is frequently seen that these visible lesions significantly affect their confidence and their social interactions. So as we can see in this picture, that it is a very ugly kind of proliferation leading to the raised thick pointed architecture and jet surfaces resembling like a cauliflower like growth that we discuss in our homeopathic materia medica. Then talking about the accurate diagnosis. So there are multiple various differential diagnoses also for this, and it can be many times confused with other conditions. Like periangal warts can be confused with the subungal warts or molluscum contagiosum, squamous cell carcinoma, which is obviously seen in the later stages. So conditions resembling these periangal warts also includes cons, callositis, molluscum contagiosum, squamous papilloma, keratocanthoma, and these can be easily diagnosed with the clinical examinations only. And homeopathic management must always begin with the precise diagnosis before remedy selection. As we can see in this slide, that periangal warts, these are around the nail margins, and subungal warts are directly beneath the nail. Molluscum contagiosum, it is variably and rarely periangal. So the presentation, the blister-like formation, and these are very tiny and linear. Okay, so and the visual appearance is also different. But in periangal wart and subungal wart, the origin, the causative microorganism is human papilloma virus only, whereas in molluscum contagiosum, it is the pox virus. Now talking about the viral pathogenesis, this HPV infection leads to basal keratinocytes. After entering the epidermis, viral DNA integrates within the host and lead to the infection getting more deeper into the deep tissue. It leads to the viral particle which bypass the upper layers to attack the basal cells of the epidermis, and where it then replicates, move or migrate upwards, and then complete its incubation. Now, talking about our homeopathic aspect, now till now we have discussed its clinical aspects and all. How to diagnose, how to clinically assess what can be the causative microorganisms, and what can be the differential diagnosis. Now we'll move ahead towards the homeopathic aspect, where we talk about the susceptibility. Initially, also, we have discussed about the susceptibility. Talking about the susceptibility, so it is not necessary that all the people or patients who are uh, suffering from perianal warts, or all the people who are having um, abrasions or cut or lesions near the nail beds gets exposed to HPV infection, or even though they get exposed to HPV infection, they always suffer from such conditions like perianal warts, or they catch the infection. No, it also depends a lot on the susceptibility. Now, talking about the susceptibility, so here we'll be talking about the three main dimensions, that is internal susceptibility, environmental exposures, and the viral presence. So we'll be talking about the behavioral triggers, environmental factors, and the host factors. All these factors are necessary to understand because HPV alone does not explain the disease. Similarly, susceptibility without exposure may not produce the lesion. Okay, I'll just repeat the sentence. Susceptibility without exposure will not produce the lesion. So, homeopathy places particular emphasis on the host factor, that is the internal terrain. Talking about a patient having a habit of nail biting, a major contribution to the microabrasion and inoculation, that the patient is, because of the habit of nail biting, leading to the abrasions near the nail bed. Also, the compromised immunity, heightened psychological stress or emotional shock, okay, will also lead to the susceptibility. And the environmental factor, prolonged or chronic exposure of the hands to the water and softening agents. So, most prevalent demographic data, which is seen in the children and the young adult, accounting for 10 to 20% of all the cases suffering from the perianal warts. So, as we have discussed in the beginning, it is like a iceberg phenomenon, also called as iceberg analogy. The wart visible above the surface represents only a small fraction of pathology, and below surface it is nothing but the constitutional factor, immune dysregulation, miasmatic influences, emotional stressors, and also the genetic predisposition. So, here we can differentiate the conventional intervention and the homeopathic intervention. As talking about the iceberg phenomenon, as a conventional mode of treatment, cauterization, application of salicylic acid will just burn the wart and it will be removed. That if the superficial lesion is removed, it means the disease is cured. But as a homeopath, the homeopathic intervention include all these factors, that is constitutional immune dysregulation, miasmatic influence, emotional stressors, genetic predispositions, and the clinical challenge is to reach to the hidden and deepmost layer to treat the cause and to treat the case, or even we can say to cure the case. Moving ahead to the next slide, we'll talk about the repertoire totality and the psychotic miasm. Till now, we have discussed the clinical aspect, diagnosis, and the susceptibility. Now, we'll also talk about the miasm. This slide will introduce about the miasmatic perspective of the perianal warts. So perianal warts, these are classically associated with the psychotic miasm. As we say, there is overgrowth, there is proliferation, and dermatologically the surface become proliferative, jagged. There is cauliflower-like growth, and in the susceptibility we can see there can be deep-seated stress or immune suppression or certain compulsive behavior in these patients. In these patients, we can also find high sensitivity, tendency of fissuring of skin, and localized pain. So, all these factors, physical expressions of this proliferative tendency, leads to the psychotic miasm. And this individualized treatment bridges the physical pathology with the patient's constitution. And how we can conclude this, that the patient is at the psychotic miasm stage, or that the patient is having this behavioral tendency or these sensitivities, through only and only meticulous case taking and differentiating between the different remedies, and how that can be done with the help of the repertorial totality. Uh, so, talking about the homeopathic case taking, it is nothing but surface to the root. When we talk about the homeopathic case taking, we are always in any sort of disease condition, in any sort of case, we try to find out the root cause. And here in perianal warts, what we are doing, we are trying to address the psychotic miasm through the law of similar to treat the condition. And this central principle of homeopathy is that disease manifests outwardly but originates from the deeper imbalance. Therefore, the treatment aims to stimulate restoration of health at the constitutional level. So, the clinical challenge in the case of perianal warts are high reoccurrences because of the previous medications, local applications, electrodesiccation, cauterization, salicylic acid application, functional impact, that it is highly painful, physical discomfort, cosmetic reason, no healthy nail growth, cosmetic damage, as well as the secondary risk, that is superficial superadded microbial infection. So these all collectively explains why homeopathy treats the patients rather than the wards, because of the multiple underlying factors. And the physician try to evaluate the physical symptom, mental generals, emotional tendencies, constitutional makeup, and the miasmatic background. And as our master Henneman have said, the principle which applies here, we do not treat the wart, we treat the patient who has the wart. Considering that the several remedies commonly appear in the wart cases, and we have just shown a diagrammatic presentation of this specialized location of the wart and different types of wart. Okay. So, dermatological lexicon and primary polychrist remedies for the warts. These can be thujaoxetin talus, nitric acid, causticum, meteorenum, dulcamara, antium crude. And they're considering the psychoproliferative dominance, the thuja, nitric acid, meteorenum are the medicines, homeopathic remedies, which are highly marked. Considering the fleshy and pedunculated warts, it is causticum, Staph agria. When the warts are horny and painful, it is graphitis and ruta. In case of keratotic or fissured warts, it is entim crude and petroleum. So, talking about the most highly marked antipsychotic remedy, that is Thuja occidentalis. Okay, so Thuja is perhaps the most famous antipsychotic remedy, having moist cauliflower-like warts, jagged pedunculated growth, psychologically talking about the patient having fixed ideas, secretive personalities, having history of several vaccinations. The patient complain about the stinging or splinter-like sensation, also having constitutional complaint with that is sweetish sweat, ridged nails, history of suppressions with the vaccines, etc. Now talking about the causticum, that is second upcoming remedy. Causticum is particularly useful for the periangle or facial wart, mainly including the large jagged warts, tendency near nail margins, eyes, nose, progressive growth, associated weakness and sensitivity with having burning sensation, rawness, and soreness. The patient may also complain of contracture of tendons. The patient may seem sympathetic and idealistic mental state of these patients. Now, talking about the wart remedies, or we can say the anti-wart remedies in our homeopathy, that we can just differentiate with the help of the morphological symptoms or presentation, location, and the sensation um, given by the patients. Okay, so the thuja will that we have already discussed, causticum also. Nitric acid, the patient will have jagged yellow base, the location will be mucocutaneous junction, and the patient may complain about the splinter-like sensation. Entim crude, we can find it in location soles of the feet and palms. The patient may complain of sensitivity to cold and cold bathing. The morphology will be the hard, horny, and smooth warts. Now, I would like to present a case of mine treated homeopathically, a case of periangle wart. A 34-year male software engineer. This case demonstrates the systematic homeopathic analysis and how one can guide to the individualized homeopathic remedy selection. Okay. Presenting complaints, multiple recalcitrant warts on the right hand and fingers, rapid multiplication over the last 18 months. Previous treatment, cryotherapy, 3 times salicylic acid topical applications. There were recurrences, and the main reason was cosmetic purpose, embarrassment in the society, with mild pain when typing. Since being a software engineer, he had continuous typing work, so mild pain while typing also. Childhood history, as we said, we do not treat the wart, we treat the patient who is having wart. So we try to dig out the cause, and in that, to find that, we took the complete case checking. In the childhood history, we found that patient has recurrent tonsillitis treated with repeated antibiotic, so we can consider it as a suppression. History of suppressed tinea cruris, fungal infection in early 20s. Then, in at the age of 32, major career transition, high stress, poor sleep, with certain emotional disturbances because of the high stress. The first wart appear when patient came to us. He was 34 year. That is 1.5 year back. The first wart was appeared in the right index finger. Currently, the patient is having aggressive multiplication of the wart. Okay, so these were the main suppression or the psychotic expressions we saw in the patient in the case history. So, what did we try to find out? We tried to find out when the lesions began, what preceded it, was there any emotional stressor, was there any history of previous treatment, or any familial history was there or not. So, in the family history, we did, the patient mother had hypertension. We found that only. So, talking about the constitution of the patient or the patient per se, patient as a person. At this stage, we evaluated the patient constitutional characteristics, physical generals, mental generals, thermal state, craving, aversion, and emotional tendencies, and try to integrate these. So, we found the patient was more image conscious and more secretive, and uh, he was highly image conscious that the delusion of being fragile or made of glass combined with the secretive behavior as a massive clinical anchor for a primary psychotic remedy. He was highly fastidious, distinctly anxious about the health and the cosmetic reason, feels a constant underlying need to present a perfect image in front of others, making him highly image conscious, secretive about the personal life, and prone to fixed ideas, that is convinced a minor ache is so severe and it is a undiagnosed illness. So we took all these in the case history. Then we tried to go for the local examination, that is site, extent, number of lesions. The site was dorsum of the hand. The wart was dry, rough, slightly fissured morphology, and periangle region, explosive cauliflower-like growth anchoring on the nail bed, encroaching the nail bed. The patient mentioned the symptom of stinging pain if caught on the clothing, and aggravation in the cold damp weather. So the dorsum of the right hand and fissured texture, periangle region in the right index finger, cauliflower-like presentation. So we tried to repertorize all the symptoms taken in the case history, physical generals, mental generals, local symptoms, and the repertorial process narrowed down the remedies possibility while preserving the individualization. Okay, considering all the particulars, mental, physical generals. Okay, the upcoming remedies were thuja, causticum, and nitric acid. Based on these rubrics, the final remedy choice was thuja occidentalis, considering the psychotic miasm, the secretive personality, anxiety about the health, and aggravation from the cold and damp weather. We try to differentiate these cross referencing, and now when we finalized that the patient will require a antipsychotic remedy along with a constitutional remedy. Okay, so the upcoming remedy along with the other remedies were calcarea carb and rustox. Okay, so extremities, pain, joints, generalities, sluggishness, and all these other features of these patient concluded the calcarea carbonica, and we came to the finalization of the remedy, that is calcarea carb 200. Okay, so potency selection required a clinical judgment considering the susceptibility, vitality, disease depth, and chronicity. Okay, this clinical course demonstrate progressive improvement after initially we tried to give Thuja 1M to this patient to begin the treatment as a with the antipsychotic remedy. Okay, that is Thuja and occidentalis 1M, and then we proceeded ahead with the constitutional remedy, that is Calcarea carbonica, with single dose 200, initial moderate potency chosen to cause the vital force response without provoking severe aggravation in the established pathology. Okay, so we observed the trend rather than isolated observation. And the patient showed improvement in the 8th week. In the further weekly follow-ups, since the patient was having slight improvement, the patient was only followed up with the placebo, that is Seclec. Then in the next follow-up on the week 8, the potency was stepped up to the 1M following a return of minor morning stiffness and of the joints and the pain in the periangle region. So we concluded to 1M, and then which impacted with the symptomatic relief. And then the patient showed a significant relief, and then also was being further continued with the Seclec. Okay, so in this, what did we observe? That the parameters assessed were on the basis of the ward size, pain score, functional limitations, and the cosmetic appearance. Initially, the patient shows significant improvement, but after that, there was an aggravation, which was transient, and increase in the joint that and the ward. And then, when the remedy was accelerated, so then there was a secondary amelioration leading to the rapid subjective relief in the pain, and then a significant improvement. Okay. Okay. So this study I had done, and there are multiple published studies also and clinical observations which provide supportive evidence for the individualized homeopathic treatment, which although further research are needed to accumulate and gather the evidence which suggests the potential benefit in the chronic dermatological conditions. Okay, so there are highly clinical efficacies in the homeopathic management we can see in the dermatological conditions, and it is also important to go for more rigorous research which is needed and accumulate a highly evidence based collection of cases to make it more potentially beneficial for the society to treat such chronic dermatological conditions. Okay, now talking about that, there can also be certain limitations, and in that, what can be the limitations? That is, there has to be individualistic approach, not only that a mere antipsychotic remedy will treat all the bad cases. Not all the psychotic remedies are capable of treating all the bad cases. We need to go with the individualization. It also requires a detailed follow-up and a objective documentation. A single case, as I discussed, cannot mark a high significant chronic dermatological homeopathic treatment improvements. There can be lack of control group seen, which can be the limitation for the further studies, and it also require a larger study to establish the results. So, in today's session, I would like to highlight the points that it has always to be the individualization. Okay, so when we go with the concept of individualization, we try to understand the root cause of the disease, and we do not merely try to treat the illness, we try to treat the patient. Okay, it can be anything, it can be at the physical level, it can be at the mental level, or it can be at the psychological level. Okay, we try to treat the susceptibility and not merely the disease or the pathogenesis, and the documents outcome are objective. We can evaluate the miasmatic background, so there is a need of miasmatic assessment also, and obviously the last thing, that is follow up of the patient, that has to be longitudinally done. So, in conclusion, I would like to say that periangle warts represent far more than a superficial dermatological lesion. They illustrate the interaction between viral exposure, host susceptibility, constitutional tendencies, and chronic disease expression. This case demonstrates how individualized homeopathic prescribing, guided by totality of symptom and supported with the systematic follow-up, can contribute to a highly clinical improvement. And I would like to conclude my presentation here. Thank you for kind attention. And now I welcome questions and discussions. Thank you.
मैम आप स्क्रीन शेयर स्टॉप कर सकते, स्टॉप शेयरिंग. थैंक यू फॉर दिस वंडरफुल सेशन मैम. वी गॉट 10 minutes. अगर किसी को कुछ डाउट्स हैं या कुछ पूछना चाहते हैं तो आप पूछ सकते हैं. मैम आप एक बार इसको जो भी आपका सेशन था इसको एक बार हिंदी में थोड़ा वाइंड अप कर दीजिए. ठीक, शॉर्ट समरी.
Okay. Sorry, I could not read the messages during the presentation. तो मैं यदि हिंदी में कंक्लूड करना चाहूँ तो मेरा सेशन था पेरिएंगल वार्ड्स के ऊपर, जिसको हम होम्योपैथिकली ट्रीट कर सकते हैं. और यदि हम पेरिएंगल वार्ड कंडीशन को देखेंगे तो एक वो वार्ड होता है जिसे हम मसा भी बोलते हैं, जो कि एक वायरल इन्फेक्शन के कारण से होता है. और वायरल इन्फेक्शन बॉडी में पेशेंट तभी पकड़ सकता है जब उसकी ससेप्टिबिलिटी हो. यदि वो उसके लिए ससेप्टेबल हो, इट कैन बी द ससेप्टिबिलिटी कैन बी एट द फिजिकल लेवल, इट कैन बी एट द मेंटल लेवल. तो यदि उसकी ससेप्टेबिलिटी है, उसकी इम्यूनिटी यदि कम है, यदि वो मेंटली स्ट्रेस्ड है, तो वो पेशेंट प्रोन हो सकता है वो वायरल इन्फेक्शन को कैच करने के लिए. और जब हम होम्योपैथिकली एज अ होम्योपैथिक फिजिशियन ये कंडीशन को ट्रीट करना चाहते हैं, तो मोस्ट ऑफ द टाइम हमारे पास पेशेंट्स जो आते हैं वो कॉटराइजेशन, रिमूवल या सैलिसिलिक एसिड एप्लीकेशन से जला के उसको निकलवा के आते हैं. तो इतने मेडिकेशन के बाद जब हमारे पास पेशेंट आते हैं तो एज अ होम्योपैथिक फिजिशियन हमें ये केसेस को हमेशा इंडिविजुअलिस्टिक वे में देखना चाहिए, रादर देन कि हाँ ये वाट है तो हमने उसको एंटी साइकोटिक रेमेडी दे दिया है या कोई हाईली साइकोटिक रेमेडी दे दी है तो उससे तो ठीक हो ही जाएगा, या पर्टिकुलर रेमेडी दे दी है. ऐसे केसेस में रिकरेंसेस बहुत देखने मिलते हैं. लेकिन हम यदि कॉन्स्टिट्यूशनल वे से जाते हैं, हम पेशेंट को एंटीसाइकोटिक रेमेडी देते हैं या फिर हम पेशेंट को कॉन्स्टिट्यूशनली ट्रीट करके देखते हैं कि उसका फिजिकल लेवल, फिजिकल जनरल्स, मेंटल जनरल्स और पर्टिकुलर्स में आपको क्या कैरेक्टरिस्टिक सिम्टम देखने मिल रहे हैं, और फिर हम उसको जब रिपेट्राइज कर टोटलिटी बना के रिपेट्राइज करके जब हम उसको ट्रीट करने जाते हैं, तो एक यदि हम सिस्टमेटिक वे से करते हैं तो पेशेंट के जो प्रीवियस कंप्लेंट होते हैं कि सारे मेन स्ट्रीम ट्रीटमेंट के बाद में जो रिकरेंसेस होते हैं तो वो हमें इतने देखने नहीं मिलते हैं। एंड एक सिग्निफिकेंट इम्प्रूवमेंट देखने मिलता है जिसको हम बोलते हैं क्योर, जो एक होम्योपैथिक प्रिस्क्राइबिंग में पॉसिबल है, जिसमें हम पेशेंट को बोल सकते हैं कि हाँ ये रेकर नहीं होगा। क्यों? क्योंकि हमने पेशेंट के रूट कॉज को ट्रीट किया है, ना कि मेयरली हमने सिर्फ उसके पेरिएंगल वार्ड को ट्रीट किया है। सो दैट इज द समरी ऑफ द सेशन।
थैंक यू मैम। किसी को कुछ और डाउट्स हैं, प्लीज आस्क। हमें क्वेश्चन है चैट बॉक्स में।
ओके, एलएम पोटेंसी ट्रीटमेंट इन व्हाट्स योर एक्सपीरियंस? ओके, हम पोटेंसी सिलेक्शन जब करते हैं, मतलब पोटेंसी सिलेक्शन के लिए जो क्राइटेरिया होता है कि हम पेशेंट की ससेप्टेबिलिटी देखते हैं, हम पेशेंट के सेंसिटिविटी असेस करते हैं, हम पेशेंट के जो प्रेजेंटेशन है, प्रेजेंटिंग कंप्लेंट का, हम वो असेस करके यदि हमें उसकी ससेप्टेबिलिटी हाई मिलती है तो ही हम उसको एलएम पोटेंसी में लेके जाते हैं। तो जैसे कि मैंने मेरे केस में डिस्कस किया था कि पहले आई स्टार्टेड विद द 200 पोटेंसी, बट आफ्टर हार्डली 2 वीक के इम्प्रूवमेंट के बाद में मुझे एक पीक दिखा था, फिर से एग्रीवेशन दिखा था, तो आई हैड टू स्टेप अप द पोटेंसी। सो सिमिलरली फॉर द एलएम पोटेंसी केसेस ऑल्सो, जहाँ पे हमें सॉरी इन हाई सेंसिटिव केसेस ऑल्सो और हाई ससेप्टिबिलिटी केसेस में हम एलएम पोटेंसी का यूज कर सकते हैं।
थैंक यू सीमी सिंह एंड कॉन्ग्रेचुलेशन डॉक्टर रुचि साहब।
थैंक यू सर।
बहुत बहुत अच्छा, आप जो है बहुत बढ़िया से बताए। यह है कि ये जो है टाइमली इंग्लिश में ही दिए, हिंदी सेशन था लेकिन लास्ट में आपने हिंदी में बोल दिए, बहुत अच्छा हुए। तो सेशन हिंदी था, मिला जुला के हिंदी इंग्लिश दोनों बोलना था, बोल सकते। नहीं नहीं, बहुत
ओके
बढ़िया
ओके।
जो है ट्रिएंगुलर पार्ट्स में आपने बताए। तो खास करके वह हमारा फिंगर में ही है ना
जी
तो फिंगर में ही होता है। और वास्तविकता में वह साइकोटिक नेचर तो होता ही है, ओवर ग्रोथ उसमें आता है। अब कारण तो ऐसे वायरल कारण दिया गया है, जो है कि यह जो है ह्यूमन जो है वायरल कारण है। तो अ, यह जो है ह्यूमन पैपिलोमा वायरस है ना, जिसके कारण से होता है। लेकिन कुछ कुछ देखा गया है कि जो ज्यादा पानी उनी में काम करते हैं है ना, उनको भी जो
जी,
है लेडीज लोग को ज्यादा करके, या जो
ज्यादा
कोई
होता है।
बासर मैन है जो तालाब उलाब में काम करते हैं, का भी होता है। और दवाई तो हमारे के यहाँ इजी है, लॉट ऑफ मेडिसिन। पूजा तो इसके लिए सब कोई जानता है, जो डॉक्टर नहीं है होम्योपैथिक को भी जानते हैं है ना। लेकिन यदि दर्द है तो कास्टकम भी है, एंटी फ्लूड भी है, हमारा
भी है।
मेडिसिन ऐसे कॉन्स्टिट्यूशनल हम ट्रीटमेंट करेंगे तो बहुत सा जो है मेडिसिन आएगा, सुखिया भी आएगा, नेटम भी आएगा। कोई ऐसा नहीं है हमारा जो है, लेकिन बैकग्राउंड ऑफ म्याजमेटिक, रोल ऑफ म्याजमेटिक है। और पूजा देने के बाद वास्तविक में परमानेंट रोल होता है, बहुत सी ऐसा है। तो बहुत अच्छा, बहुत बढ़िया बताए। वेरी वेरी थैंक्स डॉक्टर रुचि साहू जी, थैंक यू।
थैंक यू
चलिए
सो
इसी
मच
तरह
सर
से
फॉर
आइए,
गिविंग मी दिस अपॉर्चुनिटी।
इसी तरह से आइए हमारे होम्योपैथिक हर घर होम्योपैथिक, हर घर होम्योपैथिक का परम में है ना ठीक, थैंक यू।
जी जी, थैंक यू थैंक यू।
Thank you so much, ma'am. Thank you so much for this very wonderful session. Thank you to all the IFPH participants, and thank you to IFPH team for this platform. Uh, we've got another 2 minutes if you have any questions.